Good day, this is Healing Quest Center, and I'm Christina Pfeiffer, your host, here with Deborah Arneson from Healing Quest Center, founder and president. And today we're here to talk about hormone replacement therapy, or HRT. So,
lots to talk about.
To do or not to do. You know, the question is how to approach menopause, or people who are passing through menopause, and is it in their best interest to consider HRT?
Hormone replacement therapy, Christina, is very complicated, and it's variable depending on the woman. So what's happened over the past 30 years is kind of a shame, in the sense that HRT, the touting of HRT was created actually by an ad in the Wall Street Journal. And a pharmaceutical company had approached a doctor in New York, a gynecologist, and said, we want to try these hormones out. We don't have a lot of test runs, and we can't really get trial runs approved of. So why don't we just run an ad saying that, you know what, so far the tests have indicated that if women don't do HRT, hormone replacement, when they go through menopause, they're going to increase their risk of developing heart disease, osteoporosis, and cancer. Wow. It was a full-page ad, and women saw the ad, and it started an epidemic of panic. So women started running to their doctors begging for HRT, and that's how HRT became predominant and widely used in America today.
But why is it so complicated?
In the 70s. It's complicated because hormones are very volatile, and hormones need to be taken with caution. They are a controlled substance. Your body makes variant amounts of hormones every day depending on how many hours you slept the night before, how much stress you have in your life, how good or how poor your diet may be, you know, whether or not you're in, you know, the spring or summer of your life, or the autumn or the fall of your life, and the winter of your life. So the body has transitional phases whereby so many different hormones are made in varying amounts depending on many different factors. And stress is a big one. So stress is something that needs to be looked at first, second, and third, addressed and alleviated either through diet or exercise, and or, you know, natural substances like calcium, magnesium, or Calmatrol, you know, herbals, rescue remedy, homeopathics, and then see what the hormones do after you address adrenal function. It's complicated.
So what considerations should be examined?
For women, the considerations would be, number one, where you are in your lifespan, how your cycles are, how your energy is, how your mental attitude is, whether or not you're depressed and you're dealing with, you know, fatigue and lethargy and apathy, anxiety, things like that. So those are the factors that we consider first, second, and third, and we use at our clinic very exact questionnaires that allow us to assess where a woman is and what she needs. And these questionnaires are available all over the internet as well, I mean, to varying degrees. You know, considerations are vast. Does a person have a lot of stress? Is this a woman who's going through menopause but has 3 teenagers at home that are driving her to drink or distraction? And is she doing a lot of pesticides, which are endocrine disruptors, which alter hormonal function in the body to begin with? Is the brain being nourished well enough? You know, is she taking supplemental estrogens and synthetic hormones that can cause more problems in other areas? So a lot of determinations are necessary to help assess and accurately put someone on the correct path when it comes to HRT, or hormone replacement therapy.
Okay, so lifestyle definitely plays a role.
Huge, yeah. Okay. Whether or not you drink caffeine. I mean, when I went through my menopausal transition, I developed some hot flashes typically at night. Some of them were during the day, and I simply stopped wine and I stopped caffeine for almost 2 years. And they went away within a couple months. So just those 2 factors, which put more stress on the adrenals, needed to be removed for me to alleviate my symptoms. And it was an easy fix. And then I also took up acupuncture around then. So that was a help.
Now, what's considered, you know, conventional therapy for HRT?
Conventional therapy is a compilation, well, it's varied, but originally it was basically straight estrogen, synthetic estrogen. The problem with synthetic estrogen is it's derived from horse urine, and horse urine is extracted from a pregnant mare, which is disgusting, and they pen these poor mares and they do not allow them to run.
Extracted how?
Well, they impregnate the horse, and then when the horse urinates, they take the urine. But for the hormones to be readily available, the mare is not allowed to exercise, which is totally contraindicated in any animal that's supposed to run wild. So what that causes is huge amounts of cortisol to be released from the adrenal glands in that mare, which causes those cortisol, or those estrogenic-based compounds, to actually activate more freely, and cortisol creates tumor formation in humans
because it's a stress hormone.
Exactly. So it can precipitate the cancer that they have hence found since 1970 to be the biggest risk of taking synthetic HRT therapy.
Wow.
It's disgusting. It was a huge experiment done on women. Again, not good.
So what did it evolve into from that
Well,
point?
what happened when they did their 30-year trial and they had had all these women on HRT for that 30-year cycle, they went to see if bone density had actually improved and whether or not heart disease had been lowered or the risk of developing had been lowered. And they were like, whoops, no, whoops, no. And then what they did find collectively is that the increased risk of breast cancer, uterine cancer, and cancers in general rose dramatically.
Wow.
So not only did it not do what the ad said in 1970, whatever it was, you know, reduces the risk of heart disease and bone problems or osteoporosis, it actually not only did not help women alleviate those problems or bypass those problems, but it did increase their risk of developing cancers.
See, I've heard up even until recently that HRT helps with osteoporosis. So they've actually found that that is not true, or that's not the
Exercise
case.
is actually the best thing for osteoporosis, but believe it or not, the studies that are written in most of the journals that are accurate show that the exercise you do when you're young is the most exemplary way to avoid osteoporosis when you're older. So it's like there isn't a whole lot of time to recover, although it helps to exercise starting in your 30s and 40s and 50s. It's better if you exercised all the way through your teens, your 20s, and your 30s.
Wow. Okay.
So, I mean, again, you have to talk about synthetic versus natural, and what doctors are doing now because they've decided that progesterone has been missing from the estrogen synthetic compound that they've been giving women, so they've added progesterone in. The problem lies herein, you've got synthetic versus natural or bioidentical hormones, and there's a huge variance in how they first of all lock into receptor sites and what the action of those hormones are, if they are synthetic versus natural or bioidentical.
Okay. Well, we'll be right back to Healing Quest after a few moments.
For health, where people can come for specific modalities to heal their bodies.
Well, Panchakarma is a part of Ayurvedic medicine, which is an ancient healing system. A detoxification protocol.
A one-stop shop for health where people can come for specific modalities to heal their bodies.
Hello, this is Healing Quest, and I'm Christina Pfeiffer. Joining us is Deborah Arneson, the host, and we're talking about hormone replacement therapy, HRT.
Right.
We talked about a few of the fake hormones. What is natural?
Natural
estrogen?
hormones are actually considered bioidentical, meaning that they come from plant sources, not animal sources. Therefore, they lock into your receptor sites more readily. So a phytoestrogen, most renowned would be soy. It's a phytoestrogen. However, most women today are hyperestrogen, meaning they have too much estrogen in their bodies. And the reason for that is we're deriving all kinds of compounds that come from pesticides and herbicides that mimic estrogen in our bodies. So the body goes, oh, it looks like estrogen, therefore it is, sends it to the receptor site, it locks in. So we're getting lots of synthetic estrogens from other sources other than hormone replacement therapy. You get all these compounds also in our water supplies or derive them from water sources, because so many women have been on HRT and continue to stay on HRT because actually once you go on HRT, your receptor sites can actually multiply, demanding more estrogen. So I have a woman right now who's a client of ours, and she's having a heck of a time. She went on 2 sources of estrogen, Estrotest, which is estrogen and testosterone, which isn't a horribly bad compound. She's been on that for 4 years, and prior to that she was on Premarin, which is the horse urine with progesterone added to it. So she's been on tons of estrogen. Her estrogen levels were extraordinarily high when we saliva tested her, and her testosterone levels were very low. So sometimes when you take a synthetic estrogen, it drives other hormones down because the receptor sites are just becoming more greedy for those estrogens rather than testosterone or progesterone. And lower progesterone can cause, anxiety in women. It can cause libido decreases. It can cause depression in women. And lower testosterone causes increase in body fat mass. It causes a decrease in the body's libido, the body's ability to have energy. So all these hormones are synchronistic and they work in balance with one another. So taking a synthetic is ridiculous because some days your body doesn't make as much estrogen, Christina. It doesn't need as much. Other days it needs more because you're more stressed. If you're giving the body a synthetic estrogen every single day when it only needs, a couple milligrams versus, lots of milligrams, then you're going to end up with an imbalance. And too much of one thing usually stores as fat because excess toxins in the body get tucked away in the fat storage area if you can't cleave those and get them out of the system.
Okay. Is estrogen a single hormone?
No, there are 3 types of estrogen. And this is very important for women to know. There is estradiol, there's estrone, and there's estriol. We'll start with estriol because it's the youth-containing hormone. Like when I look at you and I see the beauty of your skin and the plumpness and your dewiness, I know that you're very high in estriol, and it's a youth-containing hormone that tends to be more volatile estrogen. Most doctors have never liked working with estriol because it is volatile. It's like we were when we were teenagers. We're volatile. How hormones were like winking around. Well, estriol is a wonderful hormone. It's anti-cancer estrogen, but it's hard to control and it's hard to deliver. It needs like a little bit of estradiol, which is what we call a hot estrogen. Estradiol is something we make more of when we move into our 40s and 50s. So it's a hot estrogen that can be ambiguous. It can go either way. It can create cancerous changes or cellular aberrations, or it can just be benign, depending on the person, whether or not they exercise, have a lot of stress. Now, estrone is a type of estrogen that actually is a torture estrogen, and it is a carcinogen.
Torture estrogen?
It torches the cells.
Wow.
So it's beyond a hot estrogen. It's a torture, and it does cause cancer. So we tend to make more of the estrone when we move into our 50s and 60s, more so our 60s. So like in this woman I was referring to, this patient of ours, she came in and her estrone was very high. So she's been getting the wrong synthetic estrogens with her HRT rather than bioidentical estrogens, which went to estradiol, which is the hot estrogen, and estrone, which is the torching estrogen, which is a carcinogen. And she had no estriol, which is the youth-containing estrogen that is anti-cancer. And she had no testosterone, no progesterone.
And you can decipher, you're able to decipher by doing these hormone saliva tests.
Yes,
Of which
saliva.
one that they need, that they're lack of, and what they have too much of.
Right. So in some women, there's another woman that I have who came in a couple months ago, and you know Anne. But Anne came in and she had been on synthetic hormone replacement for 25 years. And her estrogens were all excessively high. So there is a product, it's an American Indian herb called chrysin, which people can take. It has to be compounded by a pharmacist in a formulation that actually pulls those synthetic, nasty, hot, cancer-causing estrogens out of the receptor sites. But it takes time. And a lot of people don't understand that just to restore balance to an imbalanced hormonal system takes a minimum of 3 to 6 months. And most women don't want to go through the work that it takes to get there if they've been on synthetic forever, because they don't want to go through a little bit of hot flashing or a little bit of anxiety, although there's lots of natural things you can do to combat that. So we just kind of hold their hand and act as an advocate and help them through that transition off of synthetic HRT to bioidentical, safe HRT.
So even though a lot of the HRT is not safe, when they get off of it, they can still have bad side effects if they were to stop it immediately. You don't ever recommend...
Would. No. Ever, never, never. You never stop anything that's a controlled substance that you have to get with a pharmaceutical and a prescription through a pharmaceutical
Even
company.
though you find that it's bad for you.
No,
So you want to
please don't
clarify
do
that.
Yeah, don't just go stop your HRT tomorrow. You need an advocate, and a trained professional can help guide you through the transition of getting off of it. And we certainly offer those resources. So
Now what about estrase?
estrase is actually a natural hormone that comes from plant resources.
Okay.
So it's a good bioidentical. And bioidentical means biologically, it's identical to the hormones that your body makes. That's what bioidentical, that's what that term means. So estrase is fine, but most doctors are still not quite up to snuff because doctors derive most of their information from pharmaceutical reps. And these companies have stockpiles of the synthetic estrogens and whatnot.
They need to get rid of them.
They got to get rid of them, and you know what? They're trying to grab them and put the progesterone in with them, or the testosterone, to make them more usable to the body or safer. But still, synthetic is synthetic. Natural, bioidentical is different, and it's safe, unlike the synthetic. But you need to do testing to see where you're at.
Okay.
Yeah.
Okay. Now, what are the benefits and the risks of HRT?
Well, we've gone over quite a few of the risks of the synthetic HRT.
Right.
There are no benefits of synthetic HRT, although some people, you know, the ones who've been on it for 30 plus years, seem to be doing just fine. Haven't hormone tested them, but they feel great, they look great, they're not obese, they don't fight with
They
their weight,
sleep at
their energy's
night.
good. Yeah, I mean, some people just do well, and honestly, it's like thyroid medication. You know, if you've been on it for a certain amount of time, it is really difficult to get off. So, you know, but again, a lot of the women who do well with it exercise, they eat really well, they don't excessively drink alcohol, they don't take other medications. So all those factors play into how well you do with clearing those synthetic estrogens in the body.
What about the risk of breast cancer?
Breast cancer is a big risk with synthetic hormone replacement therapy. It's huge. I mean, you know, a couple years ago, about 3 years ago, I found a cyst, you know, on my left breast, and I was over at one of the local doctor's offices here who does most of the mammograms in the city of Chicago. And I was sitting in the waiting room, and I was absolutely astonished and dumbfounded by the number of young girls in their 30s running out of there sobbing. And I was like, I cannot believe what I think I'm seeing here, which is these girls are being told the prognosis is they have breast cancer. In the course of my waiting an hour, I saw at least 6 of them running out of there sobbing. And I thought, wow, this can't be happening. But you know what, we're getting so many xenoestrogens in our food chain, you know, from synthetic sources like pesticides, that I guess it could be a possibility. But it's important to know that if you don't have enough of those estrogens, the natural hormone replacement, if it's needed, of course there's also a time in the life in our cycle where we wean down off of these. We don't want estriol when we're 72 years old. You know, that's a youth hormone. It makes you, you know, youthful. It's like there's something about being very spiritual and natural in the aging process and honoring the wisdom of our bodies and knowing when to transition. But doing it healthfully is the issue that's at heart here. So again, natural estrogens will help ameliorate, you know, bone density issues and brain shrinkage and Alzheimer's and dementia. I mean, again, if you're consuming a diet that is really supportive in fatty acids, you know, and we call it fatty acid therapy, and you're able to use those fatty acids while having enough lipinase, which is an enzyme that uses fatty acids, then you know what, you'll make your hormones where needed, and the body will segue through that menopausal transition, perimenopause through menopause and out of it, you know, with grace and ease. And you'll feel good about yourself, and you'll be beautiful in the process, and you will not age prematurely.
Okay, well, thank you. We'll be right back to talk about HRT with Deborah Arneson.
For health, where people can come for specific modalities to heal their bodies.
Well, Panchakarma is a part of Ayurvedic medicine, which is an ancient healing system. A detoxification protocol.
A one-stop shop for health, where people can come for specific modalities to heal their bodies.
This is Healing Quest, and we're here talking to Deborah Arneson about HRT, hormone replacement therapy. As far as people trying to find out where they are, you know, you can take blood tests, saliva tests, which one do you think is more accurate?
Well, there's no question about what is more accurate. I mean, doctors, first of all, tend not to even test hormones, Christina, because they're managed by their managed care companies. And Oftentimes, unfortunately for physicians, they're chastised by their managed care company for running tests without severe provocation, and they have to have proof and burden of proof to show why they made a decision to do that. And it's the saddest part of what's going on in our nation right now with healthcare, is that a doctor is not allowed to be a doctor and use his wisdom and his intuition or hers and his experience and his education to assess a person properly and to set forth a diagnosis. I mean, we do a lot of research at the center, and the research has shown that a doctor is entitled to 2.6 minutes before he's supposed to or expected to pull out the prescription pad and start assessing and diagnosing. Otherwise, he's financially chastised. So, I mean, medical care isn't medical care. It's, you know, it's triage care at this point, and there's no way anyone, whatever their problem may be, hormone imbalances, etc., can be accurately assessed or diagnosed with a 2.5-minute consultation or a 5-minute consultation or a 10-minute consultation. I mean, we spend a good 2.5 hours with each initial new patient that comes into the clinic.
Wow.
It takes at least that to uncover everything, because you're going over a life history, you're going over stressors, you're going over genetic profiles, you're going over, you know, systems analysis, you're going over blood tests, you're going over all the pieces to a person's pie, you know, and putting that all together. So when and if a doctor would do a blood test, they would be prompted to probably just do one type of estrogen. And as we just spoke about before the break, there are 3 types of estrogens that are necessary to examine. There's the estriol, there's the estradiol, and there's the estrone. And each of those are significant in their own way and provocative if they're high for the latter 2. You also need to look at progesterone levels, because progesterone is something that diminishes when you're no longer in childbearing years. But along with really low levels of progesterone, you'll see people with more libido issues and depression and anxiety that's unspoken anxiety, can't put their finger on it. You know, they might have more PMS if they're a younger woman and have more menstrual disturbances if progesterone is off, and certainly much trouble conceiving if progesterone is too low. And progesterone is typically very low in people who are somewhat hypothyroid.
Really?
Yes. So that's anterior pituitary and hypothalamic function. Then you would look at testosterone, because they all have inverse relationships with one another. And testosterone would help us assist whether or not somebody has enough testosterone to keep them geared up for the great fight of life. You know, it's the hormone that, if taken in excess, can make you a little aggressive. If you don't have enough of it, you'll just work out like a banshee 7 days a week and never lose enough body fat. That can be one problem. I mean, it might be a compilation of different issues, but that certainly can be one of the issues. When you do a blood test, or when a doctor orders a blood test is going to show you only the protein-bound portion of that estrogen or testosterone or progesterone. What does that mean to the consumer? Protein is a cleaving agent. In other words, hormones are lipids or fats, and they have to cling to something or be carried by something in the bloodstream before they actually go into the liver, get broken down, and separated, and then used. So when you take a blood test, you're only reviewing that which is hanging on to an amino acid. So let's say it's a vegetarian and she doesn't eat amino acids or protein foods, so there's nothing to even carry her hormones. Now, most of our vegetarians don't consume fatty acids either, so they don't have anything to make hormones with.
Right.
Even if they are making them and they have this amazing reproductive system and hormones are good, they don't have the carriers. So they're going to end up with problems and imbalances and perhaps not be able to get pregnant or go into an early transition through menopause, etc. So when you do a blood test, you're looking at that lipid or that hormone-based lipid that is cleaving, or what I call piggyback riding, on an amino acid or a protein molecule. It has to. When you do a saliva test, you are looking not only at what was hanging onto the protein molecule, but what was broken down and what is left over. So you're also able to assess what was there originally, what was utilized, and now what she has utilized and what is left. So it's a very comprehensive picture of your or of your hormone profile. So you have to look at all those components. So saliva is kind of like a hair analysis. It's what's coming out, it's what's left over, and what you've already used and what you already have stored.
So saliva is definitely more accurate.
Very accurate.
Okay.
And you need to do all of them, because you can't just do estradiol. You need to do all those hormones at one time, because again, they all have relationships to one another.
Okay, well, thank you. We'll be right back after this break. Healing Quest.
Well, Panchakarma is a part of Ayurvedic medicine, which is an ancient healing system. A detoxification protocol.
A one-stop shop for health where people can come for specific modalities to heal their bodies.
Good day, you've reached Healing Quest, and we're here with Deborah Arneson talking about HRT. We just want to recap a little bit. A woman's hormones levels and her response to HRT and the way that she uses hormones all vary, very greatly. So how often should a woman retest her levels?
Well, that's a really good question, Christina. Once you start working, or we start working with a woman and we start balancing, taking her off of the synthetic HRT and putting her on the bioidentical, and you may do a compilation of natural with the synthetic to wean her down, we retest about every 60 days.
Wow.
So depending on the imbalances, it would be retested every 60 days. Now, a lot of people will say, well, why doesn't insurance cover this? At this point, some do, but not that many, and it's simply because the medical community and what's approved, through the AMA is usually about 10 years behind of what's actually working for people. And that's based on longitudinal studies, which clinically, we have many trials going on every day, everywhere. In our clinic alone, I see my women a minimum of 12 weeks, and it can go on for 12, 15 years. So I have historically an amazing tracking record with my clients, because once they come in and they feel better, they move into other modalities and they stay under the umbrella of, like our watchful eye, so to speak. So when it comes to testing, it's like if I see this imbalance like I do with this one woman I mentioned earlier, her negative estrogens were excessively high, testosterone, progesterone very, very low, and her DHEA was really high, which is adrenal stress, but her cortisol was really low, which means her adrenals are pretty exhausted. And the adrenals drive thyroid. And thyroid drives pituitary hypothalamus, which comes back around and helps to support ovarian function. And then pancreatic output of insulin. So that helps to regulate fat, and energy. So all these different hormones play together, and it's really important to retest as frequently as you need to, but probably every couple months.
Okay. And they come and they call you and set up an appointment?
They can just give us the jingle and we'll give them the information.
Oh, great.
Yeah.
Well, thank you so much for this incredible information. I don't
Pleased
think
to be
enough
here.
people know the true risks and benefits of HRT, and now the word is out there.
Good.
I'm Christina Pfeiffer, and this is Healing Quest. Thank you for joining us this evening. We'll see you next time.